Hi. Do you know what is the most common cause of stomach pain? It's peptic ulcer. And in the next 5 minutes, we will be talking about what is peptic ulcer, the types, and how homeopathy can be the game changer in treating peptic ulcer permanently. And also, I will share three amazing case histories from our clinic covering gastric and duodenal ulcers in both men and women. So let's see what is peptic ulcer. Peptic ulcers are open sores that develop on the inside of your stomach or the upper part of the small intestine. It's mainly caused by bacterial infection, but other factors like excessive acid, stress, and certain medications can also play a major part. The common symptoms include abdominal pain, bloating, heartburn, and nausea. Let's see a case history of Mr. Amit, a 45-year-old male who came with severe abdominal pain, vomiting, and loss of appetite. He felt very anxious most of the time and had an irritable temperament. Our homeopathic specialists at our clinics prescribed him his individual homeopathic remedy called as Naxomica. Within a few weeks, he experienced significant improvement in his symptoms. Now, there are two main types of peptic ulcers: gastric ulcer, which occur in the stomach lining, and duodenal ulcer. They develop in the upper part of the small intestine, which we call duodenum. Gastric ulcers develop on the inside surface of the stomach. The main features of the gastric ulcer is it occurs in the stomach lining, which is exposed to stomach acids. The primary symptom is often an intense and discomforting pain in the upper abdomen or under the rib cage. This discomfort can sometimes be mistaken for regular indigestion or even heartburn. Now, interestingly, people with gastric ulcers can experience relief from pain while eating or immediately after meals. But then the pain might return some hours after food. Other symptoms can include weight loss, bloating, and nausea. In contrast to gastric ulcer, duodenal ulcers occur in the upper part of the small intestine, also known as the duodenum. The duodenum's job is to continue the process of breaking down the food using enzymes which are released by the pancreas and bile from the liver. What sets duodenal ulcer apart is that the pain associated with them tends to follow a pattern or a rhythm. Pain is usually absent upon walking, it appears by mid morning, gets alleviated by eating, but returns some hours after mealtime. In severe cases, one may also experience back pain. Other symptoms can frequently involve heartburn, burping continuously, and an upset stomach. Over time, both types of ulcers can lead to complications if left untreated. It can include bleeding, perforation, and blockages. So, if these symptoms sound familiar, it's important to seek medical attention from our homeopathy clinic. Now, we treated a female 35-year-old suffering from duodenal ulcer with burning pain around her belly button, bloating, and was having continuous burping. She was an introvert, sensitive, and weepy. Our specialist prescribed her individualized medicine, pulsatilla. She noticed a significant improvement as the discomfort reduced gradually over a period of 6 to 7 months, with complete recovery by around 12 months. Homeopathy aims to treat the root cause of ulcers, limit the complications, and even reverse the symptoms. So the treatment depends on the patient's unique physical symptom and even the mental symptoms. Let's see one last case of Aniruddha, a 50-year-old woman with a gastric ulcer. She had indigestion regularly, abdominal cramps, and excessive flatulence, accompanied by restlessness and a fear of illness. Our homeopathic specialist prescribed her arsenicum album, and within few weeks, her basic symptoms reduced and she felt completely relieved within around 14 months. Now we'll see about the complications of peptic ulcer because they can be serious and can include bleeding. Ulcers can bleed if there is a break in the blood vessels in the stomach or upper small intestine. This can lead to symptoms such as dizziness, weakness, rapid heartbeat, and even fainting. Severe or untreated ulcers can lead to a hole that is called perforation in the stomach or duodenal wall. This is a serious issue that requires immediate surgical help. Peptic ulcers can lead to swelling, inflammation, and even scarring, which may block the passage of the food through the digestive tract, which leads to nausea, continuous vomiting, and feeling full very quickly, and later on weight loss. So you say goodbye to peptic ulcer pain. Book a pre-treatment assessment with our specialist by calling the number on the screen. Trust us, you don't want to miss out on your chance to lead a pain-free, healthier life. So hurry up. Connect with our experts today and take your first step towards peptic ulcer freedom. See you all in my next episode. Bye and take care.